Hello and welcome to the Center for Excellence in Healthcare Practice at Union University in Jackson, Tennessee. My name is Dr. Tim Smith, the Executive Director of the Center, and today I will be your guide as we take a tour through one of the most advanced clinical laboratories in the U.S. that serves students engaged in healthcare education, experienced practitioners, and hospitals that partner with Union University. Let's take a tour. This 19,000 square foot center located in Providence Hall, the main campus of Union University, is designed to serve students and experienced nurses both domestically and internationally to improve the skills and knowledge of the care that they may provide to their patients. Our first stop will be the simulation environment, where physiology is taught to the students along with direct patient care. The simulation environment at Union University encompasses 10 patient rooms and 12 simulators. Let's go into the control room now and take a look at the activities going on. The control room is the station in which the faculty manage each of the simulators and provide the instruction for the students through an indirect teaching approach. As you can see, the station is made up where faculty members sit at the station and they can talk directly to the students in the classroom. At any time the faculty desire to, they can leave their station and go out into the room. Within the control room, we have 10 stations that will encompass the teaching, the opportunity to serve 10 different rooms, and up to 20 faculty can serve in this control room at one time. Let's go out to a patient's room and take a look and see the activities that are occurring today. There are 10 patient rooms. The unique design of the simulation environment, one is that we have one-way glass. This is the control room in which the faculty are in the control room providing indirect instruction to the students that are in the patient's room. Within these patient rooms, there are various types of simulators: adult simulators, pediatric simulators, newborns, and women having babies. We're going to walk in one room with Mr. West as the patient, and the nursing student is Ashley, who is taking care of a patient that's having chest pain, has just completed cardiac catheterization, and understands that he will have bypass surgery tomorrow. Ashley?
Hey, this is Mr. West. He was admitted with shortness of breath and he has a family history of cardiovascular disease. And so this morning he had a cardiac cath and they noticed 3 occlusions. So in the morning he's going to have a cabbage. And right now he's having some chest pain. So we gave him a nitroglycerin and we started him on oxygen. And so we're waiting to see how the nitro works here in a couple of minutes. That's what's going on with him today.
Can you tell me how, as a student, your simulation experience has enhanced your knowledge and learning?
It has been really great to be in simulation because as a student nurse in the hospital, we're not allowed to do everything that a nurse would do, such as look at the orders and then call lab or call the doctor and really go through all the steps that a nurse does when they're working in a real setting. And so in simulation, we're in charge of everything. We're in charge of getting the meds from the pharmacy, calling lab for orders, and we really get to do everything a nurse would do, but it's in a safe setting and a controlled setting where we won't harm a patient.
Thank you. We hope Mr. West does well.
Thank you. Okay, Mr. West, how's that nitroglycerin working? Are you feeling any better right now?
It hadn't changed a whole lot.
Prior to the students going into the simulation experience, they will have a pre-conference. Following the simulation experience, the students will have a debriefing session with the faculty members. Let's join the students and the faculty to see the debriefing session.
Whenever your patient starts having chest pain, what is the first thing that we want to address?
Oxygen.
Oxygen. Our morphine is doing a twofold thing. Y'all remember this? What's the 2 things that morphine is actually helping treat?
In addition to the 10 patient simulation environment, we also have an operating room that is realistic to the environment for the induction of surgical patients for anesthetic management of surgical procedures. During this process, we can take a patient, we can induce this patient on the operating room table and manage the anesthesia for the simulated surgical procedures. Our second stop in the tour is the anatomical lab. Let's go join the students in the lab. Good morning, class.
Good morning.
This morning we're going to look at the brain, which involves a cadaver that we have back here, and the reason for that is because one of your patients in simulation environment was a patient who had neurological insult. As we look at the brain, we can look at many features of the brain, but in looking at this, this is one of the layers that we most commonly talk about, and it's called the dura mater. But inside the brain, we can also see the different hemispheres. You have right and left hemisphere, and in that we have what we call corpus callosum. which is a connecting point between the two hemispheres. The third stop on the tour is the classroom. The classroom is an important place to reinforce the knowledge taught in the simulation lab and the anatomical lab. This classroom also serves as a location which continuing education is provided for the community. In collaboration with the classroom, the techniques and the skills that are taught from the textbook, the students have the opportunity to come into the skills lab, where they may provide procedures such as starting an IV in an arm such as this, or providing patient care as they walk up to the bedside and provide wound cares or trach care with the patient. Many of these techniques are basic techniques that they will learn prior to going into the simulation lab. In conjunction with the skills lab, the students have the opportunity to serve within the health assessment lab. The health assessment lab teaches the students to observe the chief complaint and the associated vital signs that they may need to assess in addressing the pathophysiological condition. For further information about the Center for Excellence in Healthcare Practice or academic programming at Union University, just look at the website. I hope you've enjoyed the tour of the Center for Excellence in Healthcare Practice and look forward to the days ahead where we can partner together to serve you.